Okay, let's talk about tennis elbow. And here's the thing, you don't have to be a tennis pro or even have picked up a racket to get it. So today we're gonna dive into what this super common and frankly really annoying pain is all about, and most importantly, what you can actually do about it. Ever had that nagging ache right on the bony part on the outside of your elbow? It's that kind of pain that just pops up out of nowhere when you, say, grab your morning coffee, or you're wrestling with a stubborn jar lid. If you're nodding along right now, trust me, you are definitely not alone. Well, that pain has a name, and it's tennis elbow. The fancy medical term is lateral epicondylitis. But here's what's so interesting about it. It's not usually from one big injury. Nope. It's what we call an overuse injury. It's all about the small, repetitive things you do day in and day out that put a strain on those forearm muscles. So let's get into the nitty-gritty. What is actually going on inside your arm to cause that pain? Let's take a closer look. You know, it's funny, because when you hear elbow pain, you automatically think the problem is right there, deep in the elbow joint, right? But with tennis elbow, the real culprit is actually the muscles in your forearm. Yep, the ones that you use to pull your wrist back and straighten your fingers. Just think about it. How much time do we spend typing, using a mouse, or even doing stuff like gardening? It all adds up. So what happens is, when those muscles get overworked, you start to get these teensy tiny little tears. We're talking microscopic injuries in the muscle and in the tendons that attach that muscle to your elbow bone. And what happens when your body has an injury? Inflammation. And what does inflammation bring with it? You got it, pain. And that right there explains why the pain isn't usually a constant dull ache. Instead, it flares up when you do certain things. All of a sudden, simple stuff like gripping a hammer, lifting a grocery bag, or even just twisting a doorknob can become surprisingly painful. It's because those actions are putting direct stress on those little tears we were just talking about. Okay, I know what you might be thinking. Hearing words like tears and inflammation can sound, well, pretty scary. And it's totally natural to wonder, oh no, am I gonna be stuck with this forever? Is this a long-term thing?
Well, I have some really good news for you. The answer might actually surprise you. Just take a look at this number for a second.
Yep, you're seeing that right. A whopping 9 out of 10 people fully recover from tennis elbow, usually within a year. How great is that? It really drives home the point that for almost everybody, this is a temporary issue that you can get through. Now, that is fantastic news for sure, but we do have to be realistic here. It's not always a quick fix. See, tennis elbow is what doctors call a self-limiting condition. And that's just a fancy way of saying your body is actually amazing at healing it all by itself. But, and this is a big but, that healing process takes time. It can be anywhere from 6 months to even a couple of years. So patience is definitely your best friend here. Okay, so we know that your body's got this, and recovery is the most likely outcome. So the big question is, what can you do to help it along the way? Let's break down a super simple 3-step action plan to get you on the path to recovery. All right, step 1, this is probably the most important one, and it's something you can start doing like today. It's all about initial self-care. First things first, you've got to reduce the strain on that arm. Seriously, give it a rest as much as you can. Using a cold pack or even a bag of frozen peas on the sore spot can really help calm down that inflammation. Another game changer, a supportive brace or strap worn just below your elbow. It helps take some of the pressure off that tendon while you're moving around. Okay, so what if you are resting and using a brace, but the pain is still pretty bothersome? That brings us to step 2, checking out some over-the-counter options. Basically, you've got 2 main choices here. You could try simple painkillers like paracetamol, which basically just help turn down the volume on the pain signals your body is sending. Or you could go with an anti-inflammatory gel that has something like ibuprofen in it. The cool thing about the gel is you rub it right on the sore spot, so it goes to work targeting that inflammation directly at the source. But what if you've done all that and the pain just won't quit? Well, that's when we move on to step 3, which is all about knowing when it's time to bring in the professionals and see a doctor. Here's a good rule of thumb. If you've been doing all the self-care stuff for a week or 2 and things aren't getting any better, or maybe they're even getting worse, that's your cue to make an appointment. Your doctor can make sure it's actually tennis elbow and might send you to a physical therapist. And that can be huge because they'll give you specific exercises to strengthen those muscles so this whole thing is less likely to happen again. All right, so let's do a quick recap. What have we learned?
Tennis elbow is basically just an overuse injury in your forearm. That's why it hurts when you grip or twist stuff. The most important thing to remember is that you can start feeling better with some simple self-care. And for almost everyone, getting back to normal is totally achievable. It just takes a little time.
So I want to leave you with this one last thought. Pain, it's not just a nuisance, right? It's a signal. It's your body's way of talking to you. In the case of tennis elbow, it's probably screaming, hey, maybe ease up a bit, or how about we take a break? And that makes you wonder, on a bigger scale, what is your body trying to tell you?